Greetings, everybody. Jamaica's healthcare is in crisis. This is not new, but I'm going to share some testimonies from individuals who are going through it.
Right? And she stood there. She not gone near to the child, I know we know. She stood at the door. What is the child's name? And I was telling her, you're going to ask some little information. And is she coughing? Say, Missy, she's going to cough. She must be coughing. She went cough no because her chest tight. She's not coughing no cold. And she, oh, I said, can she get some oxygen? She needs to go on the oxygen machine. She can't go on it. She said she don't have any bed space to give her the oxygen. But we say she don't need a bed. She could stay right here and get the level. She said it has to be done in a particular area. And she has no bed space. The same person who put the thing on the finger said to her, oh, we're going to hook her up out here, saying no. And there's a big oxygen tank out there. And she said, we can't hook her up out here, so. And the doctor, and the assessment doctor said, no, she can't do it because the last time she did it, she got in trouble and she walked away. Yeah.
So I reported recently, things that are happening in the hospitals and how these frontline people are the ones that are being blamed. And I'm not saying that some of them couldn't benefit from some training and to be a bit more empathetic, but it's almost as if they have given up. This woman is telling the story about her child who's asthmatic coming to the hospital and how she had a difficult time just getting someone to administer some oxygen, and as a result she lost her daughter. The thing is getting uglier by the minute.
So she come back again and she finishing now her little at the end she said, I will have to either there's no bed space for her to get the oxygen level, I will have to take her to either KPH or chest hospital. There's no space. But I'm saying, but she can't get it here, so the security guard was here, big man. I don't even know his name because I'm not think if you ask somebody no name, you know. My own.
So the mom is here saying that the security guard actually showed her more compassion, gave her more assistance than the very doctors who were there to save lives. This story is terrible. I'm going to put a link in the description so you can watch the whole thing for yourself. And then there's also another story told by a gentleman in the prison about a woman who was sick and the difficult time it took for them to even get the ambulance there and to transport her to the hospital. The delay is always causing lives. I'm not sure what's going on. It just seems so, oh my goodness. And then to top this off, Dr. Tufton, Minister of Health, is disputing a claim by New York City claiming that Jamaica has the second largest case of outbreak within a short period of time. And he's refuting that and looking at the numbers to say, how is it possible that Jamaica should be standing there? That's another thing I'll link for you to watch as well. I mean, this thing is getting scarier by the minute. Not scary because, we're worried about that thing, but to say that in the country where there are people who are supposed to govern the nation and the people, they can't depend on them for healthcare. Yet, they managed to get millions in support to fall in line with this new agenda. I don't know what else to say except to, pray for your family, pray for your loved ones. If you're traveling to Jamaica right now, you're traveling in a time of crisis. Very scary indeed. But the hand of God is always working. Never forget that. But I say condolences to all those people who, go in for simple medical issues and lose their loved ones because the system is so broken. It's very unfortunate. and very scary for those who live there or those who happen to travel there and might run into crisis. It is scary.
Only thing is just to get her going. All she had to do was get her stabilized. So I'm here waiting to see, all right, maybe she gonna seek some little help. You know, if you put her on some weed, one of the tank them come now. Just put it on her and stabilize her and say, mommy, you can't go get no space, no kind of bed no day here to make her admit on the wall. She can't admit on the wall and a bed no day here. So take her to elsewhere. But just stabilize her for me. That's all, you know. And send me away now. So if you stabilize her now, and then me know the one go, then
Mom was just pleading for help. Those who were in position to help her did not.